travel surgery got such a bad rap, or gets a bad rap, because people go to like Atlanta and Miami, like chop shops, and are there for 24 hours and are flying back. What we now can explain to patients is that you're not coming to see me for 24 hours. This is at least a 10-day, maybe 2-week experience, and we can do it safely.
I'm here going today with Dr. Carey Campbell. We're here live at the Aesthetic Meet. Thank you so much for coming.
Glad to be here. Thanks for having me.
Yeah, gosh, you made a huge change recently. So you were in Memphis.
I was,
at a very large practice.
Yeah.
You just went all the way to Philadelphia, right? And joined with Dr. Ron Stark. And that's a big change for you. And I was curious, like, what was that like for you, going to a different city, your patients, large practice to a smaller practice? Like, what is that like?
It's a huge change, but it's been all that I really hoped it would be. I loved being in a large practice for a long time. Mm-hmm. It allowed me stability, and it was a great place to start my career. I don't think I would be the surgeon that I was today if I hadn't started where I was. And it was great from a family perspective. But now, as my practice has sort of become more niche, and I'm focusing mostly on facial surgery and a little bit of breast surgery, our practices just evolve and are different. And at this point, it made sense for me to be in a truly aesthetic, cosmetic only practice. And being in the smaller practice allows me to give a little bit more of a concierge feel to my patients, which I think, as much as a large practice tries, you're trying to accommodate so many different surgeons' feelings, financial incentives. Like, there's different dynamics at play in a large group. And I was ready to join a really good friend. And we have the ability to sort of make this very niche concierge feeling practice for patients. And that was the big impetus for my move. And it's also exciting to be in a bigger city.
Yeah.
Memphis was home for me, and I loved it. And I don't know. I think the opportunities that a city like Philadelphia has, it's such a growing city. It's like one of the fastest growing job markets. And so just in terms of being able to capture more patients, grow the business, and also then just opportunities for my family.
Oh, that's amazing.
Yeah.
How did your existing patients in Memphis sort of take the move?
It was really heartwarming and bittersweet. A lot of them are really sad, and I'm sad to leave those people. At the end of the day, I do this because I love my patients. And a lot of my facelift patients I have relationships with, they all have my cell phone number, and I get texts from them and photos. So, they took it hard, but what's been the most complimentary and flattering thing that I think has happened is that I've had so many of my patients move their care up to Philadelphia. I think that, especially with facial surgery, patients have become used to the concept that they may travel for it.
Yes, absolutely.
And that what's in your own backyard may be great, but if it's not, and you have a connection with another surgeon, that it's okay to travel, and it can be done safely.
Yes.
I think that travel surgery got such a bad rap, or gets a bad rap, because people go to like Atlanta and Miami, like chop shops, and are there for 24 hours and are flying back, and unsafe things happen. And I think what we now can explain to patients is that you're not coming to see me for 24 hours.
No.
This is at least a 10-day, maybe 2-week experience, and we can do it safely, because that's the acute period we really need to take care of patients. And technology makes it such that I can FaceTime, I can do a teleconference, a telemed visit with my patients. And so 8 of my patients have already moved their surgery from Memphis to Philadelphia just for this year. So it's great. And the patients who really have a connection with me, I think, have said things like, "You're just a plane ride away. It's not going to be that bad."
That's lovely, actually.
Yeah. And then, this is also part of, I feel so fortunate to be able to say this, but part of what gave me the confidence to be like, this is the right time to make this move, is in the last probably, year to 2 years, my practice has evolved to have a lot of traveling patients to me in Memphis. But then there would be things that were difficult with them trying to get to Memphis to see me, and just the accommodations and the experience I wanted to offer them if they were going to be willing to travel to see me. I feel like I can do that better in Philadelphia. So, I was seeing patients from New Jersey, Florida, California, North Carolina. Like, these are all these wonderful women that actually did have a connection to me through Memphis somehow. But, then their friends talk. And so it's now traveling to see me has become kind of the norm, which
I
is
love that.
nice.
That's really amazing.
Yeah.
You mentioned earlier that you have a focus on face, right?
Right.
Faceless, facial plastic surgery. I'm curious, how did you get there, right?
Yeah. So it all started when Dr. Stark and I were residents together, honestly. We worked under a man named Fritz Barton, who is long retired, but actually he retired 10 years ago. But he and a man named Sam Hamra were like the godfathers of deep plane facial surgery. And unfortunately, I don't think they get the credit that they deserve because they weren't in the ENT facial plastics world. They were in the plastic surgery world. But their papers go back to like the 70s, 80s. There's some great papers in the 90s, but they were our mentors, right? And so I fell in love with it. And then Dr. Barton encouraged me to pursue a facial fellowship in New York. So he helped facilitate that with me. So I did the Manhattan Eye, Ear, and Throat facial fellowship with Sherelle Aston and Dan Baker. Steve Levine was there. Those are the people, the names that you would know.
Yep.
And it was an amazing year. And I really fell in love with facial surgery, right? That's the moment that it happened, I think, for me, was those last few years of my residency and then my fellowship. And I will say, though, in the last 3 years, as much as I wish like some of the facial plastic surgeons would give more credit to like those two pioneers, I have learned more from the facial plastic surgeons than I ever anticipated that I would. And I think an openness to realizing that our two fields like really need to collaborate more. And that when we work together, we both are smarter and better and take care of our patients better is really, there's so much room for growth and opportunity there. So, I mean, I think you see a lot more facelift courses happening that are across specialty. And those courses have like just totally changed my practice for the last 2 or 3 years, I'd say.
Wow, that's incredible. Well, I've seen your work. You do phenomenal facelifts.
Thank you. Thank you.
The next subject is it's kind of a funny one to broach, but it's something I could relate to, right? Is that you're a female plastic surgeon,
right.
And there is a big lack of those in this space, although it definitely has improved over the last few years. Yeah. It's something I can relate to because there's give or take 35 medical marketing companies in the space that you're going to walk around here at the Aesthetic Society and see. And every single one of the presidents and or CEOs of those companies are men. Yeah. I am quite literally the only female.
Oh, wow. That's very impressive.
As a president here for Influx. But so it's a factor in this space. It's an interesting factor in this space. Sure. And I am curious to see, as a female plastic surgery, has that made things more difficult for you? Has it made, in some cases, things easier for you? What's that been like for you?
Well, just so that you're aware, while only 20% of practicing plastic surgeons are female, 60% of residents are female.
Oh, gosh, that's beautiful.
That's about to change. Get ready
I'm
or not.
I'm so excited. That's such a great, and I know it's been improving, and I've seen it at the Residence Forum, and I've seen it at ASPS as well. Yeah, but I didn't know it was 60%.
Well, I learned that statistic yesterday at the Women's Aesthetic Symposium. Thank you for being a contributor to our swag bag.
I love it.
But it's growing. And, this is controversial because the last thing I want to say is that my male colleagues are in any way inferior to me. I mean, I don't feel that way.
No.
I've had plastic surgery myself and men have operated on me.
Right.
So, it's like, I'm not saying anything about that. I think that it's really patient specific,
yes.
And that's what it comes down to. In my current practice, there's 2 women, or in my previous practice, I guess I should say, there's 2 women and there's 3 men, right? And when a patient walks in the office, for better or worse, I can tell if that patient's going to see a woman or if that patient's going to see a man. Yeah. I'm not going to go into the criteria that I can tell. But there are certain women that really jive with a male plastic surgeon, and that is right for them.
Yes.
But then there are other women that they just identify with my experience in a way, and I identify with theirs. I'm sitting there talking to my patients about their perimenopausal issues and if they're going to be able to stop their estrogen and their progesterone and how they're going to feel around surgery. And I'm like, please don't stop your hormones. And they're like, oh, it's nice to hear a surgeon say it's going to be okay, because I couldn't go off that. And I'm like, I can't imagine asking my patients to do that. So I just think that there's a little bit of relatability, that as a woman I have to my patients. It doesn't mean that my male colleagues don't relate to their patients well. They just have a different dynamic than I do. And Dr. Stark, who's my partner, is, I think, a fantastic surgeon and doctor. So, I mean, I have nothing but the kindest things to say about him. And I just think you have to figure out as a patient what jives with you. But I'm excited to be a woman in the facial surgery field. There are not enough.
There's not
They're
enough.
just simply not enough.
Yeah, particularly in facial plastics,
Yeah.
actually.
Yeah, exactly. I mean, I think Elizabeth Chance has really taken the flag of a female like facial surgeons, and she has given such legitimacy, because I think women for a long time, it's a tedious, hard surgery, and it's kind of like microsurgery. Like it's one of those things that you're committing your day to that patient,
Yes.
and it's a lot for like from a lifestyle perspective for a woman to take on. I guess
Yeah.
is kind of the thing, but like, you know, I love that surgery. I could spend all day doing it every day. So I think you just, as a woman, you have to find what really jives with you. You know, Gabby Mioto in Atlanta is the same way. She's a fantastic female facial surgeon, and I think that we'll see more and more of them. I hope to see more and more of them on the podium,
Yes,
talking
me
at
too.
conferences. I think that will really help. It's just, you know, like as much as I wish it weren't the case, sometimes our life priorities are different than our male colleagues, you know?
Yeah, it's a fact. It's a fact. And the truth is that one could argue it's not just about plastic surgery. It's a very intensive career,
Correct. Yeah.
right? Time intensive career. I come to these conferences and I'm standing next to, my colleagues like Adam and Max,
Yeah.
right? And people will go up to me and go, "Who's taking care of your baby at home?"
Yeah.
They're not asking Adam and Max. They got kids too.
No, I
They're
know.
not asking them.
I
I'm
know.
like, my husband does.
Yeah.
And this is my 5th conference in 6 weeks. And,
Yeah.
bless his heart, he does it every time.
I could
And
not.
that's our modern relationship.
I know. People may think my relationship with my husband is non-traditional, but I mean, he's been undeniably the rock that has supported my career. And I couldn't do it
Absolutely.
without him, just like a lot of the men that are here couldn't do it without their wives.
Yeah.
But my husband is great. I have 2 little girls that I love very much, and it's nice to get to FaceTime them and do all those things when I'm here. But he has fortunately really embraced the role of
Right.
like being a great dad. You know, and I'm a great mom. It's just
you are a great mom. I'm
Yeah.
a great mom. But
Yeah.
our husbands are also
Really
phenomenal
good-
dads.
like really good
Like
dads.
really, really good.
really, really good dads. So
Above
I'm very-
average,
Yeah.
And just
Yeah.
to be honest, and it's
you know,
nice.
It's funny. It's like sometimes I take for granted how unusual
Mhm.
that is. And then I hear other women talk about like how much their husband does or doesn't do. And I'm like, I can't tell them how much my husband does, because they'll be like, where did you find him? You know,
I
like,
know.
I'm like,
There's something that I can't like mentally conceive of. Like
Yeah.
I'm like, he's always took care of diapers and
Yeah.
so have I.
Right.
He has his own career.
right. So is my husband.
Yeah, it's not like he's a stay-at-home dad or
Right,
anything like that. He
right.
definitely has a very serious career and he does
Yeah.
quite well for himself. It's just that we're in it together.
Right. Exactly. We're partners.
We're partners. Yeah, that's
Exactly.
it. Which allows us to also be as busy as we are,
Correct.
right?
Correct.
Which is really nice. Which I think is some of the things that would have to change for more
women.
women and
Yeah.
more back to the original thing, more female plastic surgeons.
Right. Exactly.
And
And
it
I
is
mean,
an intensive career.
my husband is proud of me when I tell him like, oh, I got asked to speak on this panel. I'm going to have to go to this conference. He's like, that's fantastic news. You know, like, I'm so proud of you.
I know, it's
And to
lovely.
have the support of your family to do that, it's critical.
Yeah, and we're setting good examples for our little girls
Exactly,
too, which is
exactly.
actually really nice.
Yeah.
And it does allow us to do things like take them for a trip for a couple weeks, and
Yeah.
there are
Yeah.
certain things it does allow for that will result in more time with them too.
Yeah, absolutely. It doesn't have to be all work.
No, it doesn't have to be all work.
Yeah. Yeah, exactly.
Well, this has been so great. Thank you
Thank you
so
for having me.
much, and we're gonna have a fun time. We have a few days together at the aesthetic meet.
I know. It'll be great. Thanks again.
All right, thank you.